As new variants emerge, the leading vaccine makers are beginning to test booster shots. They're experimenting with a range of approaches, from new recipes to blends. ABC 10 News anchor Derek Stahl is going in depth on the 4 leading strategies.
All of the U.S. vaccines are effective against severe COVID-19, but studies are showing they're somewhat less effective against certain variants, particularly the one discovered in South Africa. That variant has mutations that allow it to escape a number of the antibodies generated by the vaccines. So Pfizer, Moderna, and J&J are responding, and you could call their first strategy a basic booster. It's the exact same formula given one extra time. A third shot in the case of Pfizer and Moderna.
That has the advantage of simplicity.
Dr. Alessandro Setti of the La Jolla Institute for Immunology says it's the easiest approach to test and manufacture, and the idea is to have strength in numbers.
Basically, you can stop a virus by starting your immunity at a much higher level.
Even though the variants can dodge some of the antibodies, the concept is to simply boost the total number of antibodies. Pfizer projects it'll increase 10 to 20-fold with one more shot. But the timing of that booster will be key, says Dr. John Bradley of Rady Children's Hospital.
Theoretical possibility that if I get a booster of that same vaccine, especially within a fairly short period of time, I'll have an even stronger reaction.
The companies are experimenting with boosters given 6 to 12 months later. The second strategy is called a strain-adapted vaccine. This is when scientists come up with a new recipe specifically for a variant.
The fact that we can take an mRNA vaccine and just immediately reprogram it with a new variant is an interesting concept, and I think is one of the major innovations in terms of vaccine development.
Pfizer, Moderna, and J&J are all working on shots with recipes tailored to the spike protein in the South Africa variant. But what if a country gets hit with a different variant, or the virus mutates again? Moderna and J&J are testing a third strategy called a multivalent booster. This one is a blend, like an Arnold Palmer, where scientists mix the original vaccine with an updated recipe in one shot.
That's what we get for influenza each year. Influenza changes, mutates, and so we need new vaccines each year. And what we do is we pick the most prevalent strains that are likely to circulate, and we put those in the current vaccine for that upcoming season.
The downside is that a multivalent shot can be more complicated to make and test, and for now, Pfizer is not pursuing it. The fourth strategy is the most experimental and probably the farthest off, what Dr. Setti calls the Spike Plus approach.
Spike is really the best target for neutralizing antibodies, but there are several other proteins.
Some companies, like Gritstone Oncology in California, want to make a vaccine that goes after multiple spots on the virus, not just the spike protein that all of the current shots are based on.
Other parts of the virus may be less easy for a virus to mutate.
Whatever the strategy, vaccine makers are hoping to have the first booster shots authorized and ready by the summer in case they're needed. Derek Stahl, ABC 10 News.